Welcome to this explainer on the prior authorization crisis. Look, if you're a healthcare CFO or an RCM leader, you're going to want to pay close attention to this one. Today, we're exposing exactly why your practice is leaking revenue right now, and more importantly, exactly how to stop it. Let's dive in. First, consider this number, 31%. That is the staggering year-over-year jump in prior authorization denials hitting the healthcare industry in 2026. It's a massive spike. And it represents a $35 billion hemorrhage across the industry. Why so high? Well, because nearly 2/3, 65% of denied medical claims are just abandoned. They're literally never resubmitted. That creates a massive, unrecoverable revenue hole for your organization. What we're looking at here is a classic David versus Goliath scenario. It's a totally unfair operational asymmetry. On one side, payers are deploying advanced AI systems to review and often deny claims in literal seconds. On the other side, providers are stuck fighting back with slow, manual workflows, disjointed portals, and faxes that can take days. And just look at the sheer scale of this payer adoption. 74% of health insurers are already using automated AI systems for approvals. They've optimized for absolute speed. Which means if your team is still running a manual prior auth workflow, you aren't just behind. You are fundamentally outmatched. So that brings us to our burning platform, the 2026 CMS Band-Aid. This is what shifts the executive narrative from "we should upgrade eventually" to "we absolutely must upgrade right now." As an executive, these are the key compliance dates you really cannot afford to miss. The rules for 72-hour urgent prior authorization decision turnarounds, 7-day standard turnarounds, and providing specific written denial reasons, those are actually already in effect as of January 1, 2026. And this is all driving rapidly toward the full electronic FHIR-based API mandate going live in 2027. You simply can't afford to wait on this. So how do we actually fix this? Well, AI levels the playing field. Automation replaces all those hours of manual portal entry with 3 core capabilities. First, Coverage Requirements Discovery, or CRD, instantly checks the payer criteria. Second, Documentation Templates and Rules pre-populates your required EHR data. And finally, Prior Authorization Support submits and tracks the whole thing electronically. This intelligent workflow pretty much guarantees first-pass approval and eliminates 45% of those tedious manual touches. An AI-driven RCM isn't just theoretical. It is deeply, deeply profitable. Take the Care New England case study, for example. By implementing prior authorization automation, they hit an 83% clean submission rate. They reduced turnaround times by an incredible 80%, saved over 2,800 administrative hours, and preserved $644,000 in avoided write-offs. And that was all in just one single year. If you're ready to modernize without completely disrupting your clinical workflows, here's your rapid-fire 5-step action plan. Step 1, audit your current workflow to find those bottlenecks. Step 2, confirm your EHR readiness for the new FHR APIs. Step 3, evaluate AI-driven platforms like RevPro. Step 4, pilot the software with your high-volume, high-denial specialties. And finally, Step 5, integrate that prior authorization automation directly into your broader RCM stack. Now, this is exactly where we step in at ProMantra. The ProMantra Advantage is custom-built for today's high-speed RCM environment. We give you end-to-end prior authorization management that handles absolutely everything, from identifying requirements right through to denial appeals. We operate with fully ISO 27001 and HIPAA-compliant data security. We utilize preloaded libraries covering over 600 payer policies, and we deliver seamless EHR integration with predictive denial analytics to stop those revenue leaks before they even happen. So, I'll leave you with this final thought. How much is your outdated fax and phone workflow really costing your bottom line today? It's time to find your revenue leakage before it turns into a full-blown crisis. Contact ProMantra right now to get your free RCM audit, and let's take control of your revenue cycle together.